Well, hello and welcome to all of our viewers here today. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. Well, I'm delighted to be back with you once again, talking about our neonatal conference that's coming up. So we have our conference coming up right around the corner here. Excited to say that everything is ready for you. Early bird is still in effect. It begins on May 31st. These are going to be important things for you to know. Okay, so mark that on your calendar right now. We'll come back to all of that in just a moment and how to register and how to sign up, because I can't stop smiling, honestly. I've got a friend and colleague here today back with us here at Gold, and I'm excited to get to introduce her once again. So Dr. Sharon Unger, welcome back here.
Oh, thank you so much. It is really cool to be back with you.
Well, it was cool to be able to send out the invite again. You talked so well at a previous event here at Gold, that this was it was a delight for us really to have you back, knowing your expertise and of course your giftedness in presenting is just wonderful. So thank you for all of that. I've already got the inside scoop on this presentation. I will tell people, I want to be honest, I've already heard it. It's fabulous. You're not going to want to miss out, but I'll let Sharon update you a little bit more on that in a minute. But hey, Sharon, let's have you formally introduce yourself. Tell folks where you are in the world. Remember, we got folks coming in from right around the world here. So tell them where you are and what are you doing? Well, I want to know what you're doing day to day right now. What's happening?
Well, I'm in Toronto, Ontario, Canada. It's warm right now, but not always. I work in a neonatal intensive care unit. I'm a physician in the intensive care unit, and I'm the medical director for the milk bank for our province of Ontario. And I think it is a super exciting time to be working in human milk research and to be working in donor milk because, as you know, research totally shut down in human donor milk during the HIV pandemic, and it's come back on in this century, and I think it's come back on gangbusters. And fortunately, we did not shut down during the pandemic. What was interesting to see in the pandemic is that we were worried, but it seemed to be with parents at home with their children. They had time to express milk and very, very generously donate their milk to milk banks. So we've continued to be able to grow through the pandemic.
Oh, that's wonderful. Yeah, and I've been talking to several folks who work in the milk banking field who, like yourself, have a significant role. And I'm hearing the consistency amongst all of you, to be honest. Like I'm hearing that things are, there's a big turning of the tide. There's a trending in research. We're seeing things move forward. What did you see during the pandemic? This was really interesting. It came up in a conversation yesterday, that there was a little lull actually in the neonatal units with our preemie babies and during the pandemic, but things have sort of picked up again. Did you see the same thing out of Toronto?
Um, maybe a little lull,
Mm,
but unfortunately, preterm babies did continue to be born. And what was hard to see was families impacted by COVID in real time and
sure.
parents separated from their children. I think that the hospital really did step up and found ways to have the milk safely transported into the hospital and
Good.
found ways of creating video links for parents who were sick at home and not allowed in to visit their babies. We had video links, but for families who were really sick, it was great to have donor milk as
Mm,
a bridge in time until parents could get back into the NICU. So
mm.
it was important that we had higher volumes in the milk bank as well.
Right, the safeguard of having alternatives available. Absolutely. Yeah. I mean, if anything, a great reminder when there is a crisis, which is what we've been in, that we have the accessibility to, to milk, because the pandemic is not the only crisis that we see around the world. There's been lots of different natural disasters, war, things like that that can have implications on needing the need of human milk at these milk banks, right, Sharon?
Right. And what I show in the research that I presented in the talk is that donor milk is not the same as a
Hmm.
parent's own milk. It doesn't have the same performance, certainly superior than preterm infant formula, but clearly not a replacement for
Hmm.
parent milk. So I think that's another exciting part of the research, is that there's also a lot of research going into how to process human donor milk so that we can continue to absolutely assure its safety, but
Mm.
not impact all of those biologically active molecules that are so important in human milk. So lots of new research going into processing as well.
Ooh, I mean, it's really illuminating the whole field, I think, again, and hearing folks talk about it like yourself is, it's putting a whole different light on things, I feel, because for those of us, like, you're fully immersed in it. So a lot of us are, so I know you're just like, what? And I'm like, well, listen, I'm on the outside. I just get to look in, and I have that privilege of sitting with folks like yourself, but it's so exciting for me to hear that that you're still in it, and that you're sort of somewhat winning the race, because I know you feel like that there's always probably more that can be done. And how are your colleagues doing? I mean, I know you've got colleagues that are fully immersed in this too, but every now and again, you must feel like you're on the education, side again, where you're having to sort of educate folks. Folks still receiving the message well, Sharon, from your perspective?
Oh, I believe so. One of my big ones right now is looking at oropharyngeal feeds, putting human milk directly into the mouth of the smallest of babies. And there's just not a lot of research yet.
Right.
For now, we have various types of sugars that we can give babies to comfort them, to relieve pain when they're having a painful procedure.
Right.
But I really hope that there's more research into putting human milk directly in the mouth as a means of having a baby release endorphins and also exposing them to the milk microbiome. So I think that one of the ways of the future will be that we preserve early colostrum to go directly into a mouth of a baby. Even we have babies now who are born at 350 grams,
Wow.
well less than a pound.
Hmm.
And they can have human milk directly by drop straight into their mouth. It's not their full enteral nutrition, which will still need to go in a feeding tube until
Sure.
they're big enough to be able to suck and swallow and coordinate that with breathing. But when you have donor milk, you can use donor milk for the feeding tube
Hmm.
and prioritize the parent milk, the colostrum, to go directly into a baby's mouth. So that's kind of an exciting new field that I'm getting into.
Excellent. Yeah, I have heard a little bit about this, and I'm just amazed. I mean, just looking at the size of those tiny little babies, I mean, they are getting smaller, it seems, and we are able to preserve life, and we are seeing good things. Things have improved so much over the last even 5 years, I feel, Sharon, in the neonatal units as well. Is that what you're seeing too?
Well, you told me it was okay to be personal, so I'll tell you. I
Yes,
talk about
please.
my mother's story in the talk, which was that my mom was born 84 years ago at
Hmm.
650 grams. So, I think that it's obvious is the power of human milk, right? She was nursed at home in a homemade incubator with expressed breast milk in an eyedropper. And obviously she survived. I'm here.
Right.
So I think my grandmother grandmother was pretty cool, and ahead of her time. But yeah, babies are getting smaller and smaller, and I'm biased, and I will talk about research biases, but obviously I'm
Sure.
biased. And I think that, the most health protective measure that we can
Hmm.
provide these smallest of babies is truly the parent's own milk, but a human milk diet globally.
Yeah, that's wonderful. Well, I mean, there's so much to learn. And once again, I'm just delighted that you're here sharing your perspective, telling us what's coming up, and you've really set the stage, for many of us to continue on with our education in this area. Sure. So thank you so much for being with us here today. It's just wonderful having you.
My great pleasure.
And for all you folks listening in, I know you're ready to head over to the website right now. So this is how you can listen to Dr. Sharon Unger's presentation and all the other fabulous content that we have this year for you specifically. It is ready. It is waiting for you. All you need to do is head to the website right now at goldneonatal.com, where you can register for this event. Opening keynote day is on May 31st. So you can join us that day for some free content. And so no obligation to you. We've got a fantastic presentation coming up with Dr. Terry Moran, and she will be here talking with us as well and sharing her content. Thank you once again to Sharon for being with us here today. And of course, to all of you, our wonderful viewers. Bye-bye for now, everyone.